Just recording. There we go. So we're recording now.
Perfect.
And unless you have any other questions, I'll go ahead and start.
Yeah, it sounds great.
Okay, good. Hi, folks. It's Denise Howell here, and you're joining us for Uneven Distribution, the show where we visit with what I like to call the time travelers among us. I know that sounds a little hokey, but with a nod to William Gibson, who once said that the future is already here. It's just not evenly distributed. There are people who live more in the future of various events and industries than some of the rest of us. And we have a big treat today because we are joined by one of them. Peter Joyner is here with us. He is the Senior Manager of Customer Strategy and Growth at TruePill, which is a consumer healthcare company that is a startup funded by Y Combinator and others that connects telehealth and pharmacy infrastructure. Hi, Peter.
Hey, Dina. Thanks for having me on.
Oh my God. So Peter just revealed that he and I know each other from outside this show, and his family and many of my friends call me Dino. So feel free to do so throughout the show, Peter, if it's more natural for you. And we're going to talk today about the future of healthcare, since Peter is right there in the thick of it, working at a startup that is going to chart some of the future of healthcare. So, Peter, I can't thank you enough for joining us here today. I know part of the reason I do this show is just because I have so many questions about the things in our world that affect us all and what's going to happen with them and how confusing institutions like healthcare need to be unpacked and thought about. So that's what we're going to do for about an hour here today until we wrap things up. So, Peter, hope you're locked and loaded and feeling good.
Yeah, awesome. Well, thanks for having me on, Denise, and appreciate the warm introduction.
My pleasure. It's a thrill to be here with you. I've known Peter basically all his life, so I know that you're going to enjoy hearing his insights on the thorny and complicated topic of health, healthcare, and medicine. So let's start right off, Peter, and talk about emerging tech. Which kinds of technologies do you think will have the biggest impact on these areas, health, healthcare, and medicine?
Yeah, so I think there's a couple of kind of big themes that excite me in particular. I think the first one, which this is a theme in many different industries, and I think healthcare is no different, which is AI. I think there's huge potential to make healthcare more efficient with artificial intelligence. And so I think that's one big bucket. A second bucket, I would say, is in a category of kind of preventative healthcare. And I think there are things like wearables, things like diagnostic tests that are becoming more accessible to folks to help kind of prevent healthcare events from happening down the line and be a bit more proactive in your healthcare instead of reactive. So that's another one. I would say continued development in drugs. And this is, something we see in oncology a lot with targeted therapies that are based on, specific genomics that make someone a better fit for drug A versus drug B. And then other drugs like, GLP-1s that have kind of taken the world by storm from a weight loss perspective. So I think new treatments coming to, better meet healthcare needs is another huge one. And then the last one I would say is outpatient procedures and hospital at home. I think, I had a really interesting conversation with someone who said that hip replacements used to be done, entirely in hospitals, and now there are outpatient facilities that are doing those types of surgeries. And so I think that that will have a huge impact on healthcare as well. So those are kind of, I would say that big buckets that I'm really excited about in terms of technology and healthcare.
What was the one acronym you just used? CLP-1?
GLP-1.
What is that?
Yeah, so GLP-1 therapies are, they I think originally were for diabetes and kind of managing A1C levels. And essentially one of the effects of GLP-1s is pretty significant weight loss. And so you will have seen, lots of commercials, like Ozempic is one I've seen out there a fair bit. And it's definitely one in kind of the celebrity world. I think it's becoming more and more popular. And obviously obesity is a huge issue in the United States and in the world. And so, these are drugs that can help address that issue, and that, from a technology perspective, are very exciting.
What's the tech angle with these Ozempic like drugs?
Well, I think it's just, it's a different type of, mechanism of action that is, being used to, treat weight loss that hasn't been used before, right? So I think it's just a new mechanism to treat weight loss in terms of the way that the drug works. And, I think from that perspective, that's where the technology comes into play.
Yeah, I don't know about you, but I've certainly bumped into people in my life recently who all of a sudden are quite a bit thinner than they used to be. And you know that, well, yeah, I haven't had the deep probing conversations with them, but I'm pretty sure that that's the driving force behind it. And it's great. I'm sure they're happy and grateful for it. Do you see any downside to it though?
Yeah, I mean, I know this is something that I'm sure we'll get into in kind of more detail, but I think one of the things that's really cool about today is, in the healthcare sphere, is people have more access to information than they ever had. They have more ability to, I think, kind of intervene in their health and have an impact, which I think, can be a really positive thing when we think about, you know folks that are tracking their glucose just to see how different foods spike their sugar, and wearing continuous glucose monitors, or folks that are tracking their diet and what they eat through, different types of apps or experiences that help them eat a healthier diet and get to where they need to be. So I think all of the information and tools that are available to people, it can be really positive, but I think it can also be a little bit scary because, there's a lot of disinformation out there. And I think, it there's a lot of good information, there's a lot of bad. And I think, what people do with that information is ultimately going to determine the impact. And so, vaccines is a good topic where people have been, split on that in kind of the media and in the public. And I think it's, you want people to use the information to its advantage to help them. And I think when there's bad information out there, it can have the opposite effect.
Yeah, 100%. And you can't just use these tools and this data in a vacuum. It has to be used in connection with a healthcare professional to give people the correct guidance for their best possible outcome, right?
Exactly.
Right. So I know, for example, my mom has a little home blood pressure machine where she's communicating with her doctor daily as to what her blood pressure is. I think that's an incredible kind of development to be able to track that daily instead of just visit to the doctor, which can be, a month or more than 1 month apart. What other kinds of examples could you give us as to how people are communicating or will communicate with their healthcare professionals?
Yeah, I mean, I think it's interesting. I think there's different ways that people um, are kind of interacting with healthcare professionals within their network and outside of their network as well. So I think there's been a lot of cool developments in sort of what I would call the consumer health brand space, where there are companies that are basically addressing specific needs in healthcare. So there might be, women who are seeking out, birth control as an example, that don't want to go to their primary doctor for whatever reason. There are companies that can help enable that access and kind of offer an affordable solution for patients. There are, things for the men's health side of things as well. And there's a number of these different companies that are almost, I think, you know, designed to be online experiences where you can interact with doctors, have a sort of specialized care team, those sorts of things directly through the app and whatnot. And I also think within, the primary healthcare space, one of the things that COVID generally did is, telemedicine became a lot more available. And so, through my insurance company, they have a thing called My Chart, where I can send a message to my doctor, my primary care provider, ask him anything, and he can get back to me quite quickly. I can also see all of my test results, those sorts of things. So I think that doctors in general, regardless of where you fall in sort of the healthcare sphere and what type of need you're addressing, have become a bit more accessible through technology, which I think is a really big win for the patient at the end of the day.
Right. It used to be, I think, that people could call up their doctor and actually reach them on the phone in the middle of the day or in the middle of the night and ask them questions and get advice. And I think we've moved away from that kind of model, some time ago. So that's a really nice development to be able to communicate with them online, if not synchronously, at least asynchronously, and hopefully within a reasonable amount of time. I guess all this conversation we're having about back and forth with one doctor and data about oneself being collected and communicated through various devices sort of begs the privacy question. Have you seen a whole lot of developments or attention in that arena?
I think it's a really interesting one, and I think it's one that's I think something to look out for in the future. In my opinion, I think um, with artificial intelligence and just the availability of kind of data and increasing cybercrime in terms of just people. The way that they're using technology, I think it can be a little bit scary to think about the amount of information that is out there on people's health. And if there was any sort of breach of data, the types of, obviously intimate details that someone might have in their, healthcare medical profile. And so I do think that's something to watch in kind of the years to come, because it's great that there's so much more data out there. And I think it's really important for us to make informed decision about our health and to prevent, things down the line that we could see early with data. But on the other hand, with all that data availability, that can be a risk in terms of people's, private, confidential medical information. If that was able to be accessed.
Right. And as you point out, I mean, you could really build a whole profile of somebody's health history, health issues that should be confidential and secure. And they might not be if companies are not taking the appropriate steps and the steps that are more and more required by regulators. So definitely something that everyone in this field has to be paying attention to, or the future of this is going to look a little bit bleak, or we're going to have some bad example headline splashy news stories along those lines. You mentioned AI. Let's talk about the role of AI in the future of all this. There are the multiple roles, I would say. How do you envision AI entering into various steps of our health and healthcare equation?
Yeah, so I think in general, where AI will play a kind of critical role is number one in making healthcare a bit more efficient. So I think AI has the ability to kind of remove some of the expensive administrative overhead that has been in healthcare historically and replace it with more efficient technology. So, what once was, you talked about calling your doctor, it might be, an entire call center of people that are staffed to pick up the phone, route it to the right person, and so forth. Now maybe you're able to chat with, a bot on the other side that can do that job just as effectively and route you to, the right kind of solution without having the people involved. So I think, as a way to make healthcare more efficient and less costly, I think that's a really exciting piece of AI. The other piece I would say, which we talked about a little bit there is so much data out there and so much that we can use to help predict healthcare outcomes. But because the data comes from so many different sources, it can be difficult to kind of synthesize and interpret. And I think that's where AI can be a tool to help us do that in a way that allows us to generate insights and use that data to ultimately impact people's health and improve people's health. So I would say those are probably the two big areas where I think AI will have a huge impact on healthcare in the years to come.
Right. And you're talking pretty positively about having an AI either completely oriented or at least an AI assisted response to a health situation or just a health question. And there are probably a lot of people listening to this cringing a bit at that or nervous about that, thinking, gee, I don't want my doctor replaced by a machine learning model. But I'm wondering, did you ever see the episode of South Park that dealt with Chat GPT?
No, I haven't seen it.
Okay, it's worth looking up, and it has nothing to do with healthcare. What it has to do with, though, on the healthcare front is how it might impact both, I guess, the quality of a response and the bedside manner that one receives. The plot, without going into too much detail, was that Stan had a girlfriend and was had basically decided that their text exchanges were going to be taken over on his end by Chat GPT. And the girlfriend, gosh, I'm forgetting her name now, but the Stan's girlfriend on South Park, she was over the moon because all of a sudden she was getting attention and care and high touch responses that she hadn't been receiving before. And so this caught on, and the young ladies of South Park were happy for a time until they figured out what was going on. And I think that if we apply that to the medical arena, hopefully with more disclosure on the front end, you might have people happier with their experiences that are enhanced by AI involved in the response than you would by, harried or untrained or insufficiently knowledgeable people. Do you agree?
Yeah, no, absolutely. And I do think it's important to note there's definitely a lot of nuance here. And I think a lot of these things with healthcare can be a bit of a double-edged sword in terms of the way you look at it. I think you can see you can look at it from an optimistic way and kind of think about the good that could come of it. You could also easily think about the bad, right? In terms of, if we have all of that data there, in theory, could it allow employers to assess people in a way that we're not comfortable with in the future? I think there are dark sides with AI in healthcare, for sure. But I think some of the positives are really exciting and worth noting here.
All right, we're talking a lot about different kinds of emerging technologies and AI and machine learning, synthesizing all that data. How do you think all of this will work to hopefully address what I think, and I hope many would agree, is one of the biggest problems we have with our healthcare system in the United States? And that is that its availability, cost, and quality is quite variable, depending on where you are, what resources you have, that we do not have an even sort of healthcare experience in this country. Do you think technology can help that?
Yeah, I absolutely do. I think when I think about things like some of the developments in terms of the drugs, as an example, that are coming out, and we think about like an oncology as a space, as an example, there are drugs that have literally changed people's outlook from having a really poor expectation in terms of life expectancy and whatnot, to extending that out to the point that they can live their life without worrying about their diagnosis. So I think technology can create better efficacy, more high quality healthcare, and just better outcomes for people, for sure. But I also think that what sometimes comes with technology can be higher cost, which you touched on as one of the big problems. So I think you can look at these things. There's a lot of nuance with them, but using that drug example, new drugs are extremely expensive. I was hearing about one uh, therapy in oncology that on average is 500,000 a person, and it can save their lives. But so it has really positive things in terms of the quality of healthcare, but it costs a whole lot of money. And so I think that with all of these things, there's the opportunity to enhance the quality, enhance the availability, the accessibility, but it might come with added cost in the short term, which is important to acknowledge. And I think the other point I'll just hit on is, it's not necessarily evenly distributed, as you said, and we know that from the social determinants of healthcare perspective, it is not equal in kind of the way that um, people can access healthcare and whatnot. So I don't think the effects will be equal either.
So we have definitely got the problem in our country that doctors doctors are educated, and you can't really fault them and they can, make good money at their living. You can't really fault them for, in general, perhaps maybe I'm generalizing too much, wanting to seek out a nice place to live and raise a family, and that those places are not always the places that have the most dire need for good healthcare professionals to come into the community and administer care. So do you think that telemedicine will help address that problem? Do you think that it should? Do you think that we need better incentives for people to move to areas more in need of doctors? And can technology help that?
I would say I think the problem is even more upstream in terms of certain areas. As an example, certain areas might not have grocery stores that have organic produce, as an example, or kind of like ingredients that are one that a doctor would recommend. So I mean, even I think that it's possible that people are set up for failure without even thinking about the sort of the doctors that are accessible there, or kind of the healthcare system that's around them. And so I think there are a lot of pieces here that in kind of thinking about the social determinants of health that play in, aside from kind of doctor availability. I do think from a telemedicine perspective, it's amazing that doctors are more accessible than they've ever been, and I think that brings a lot of positives. But I also think that there's certain value that a doctor gets from seeing a patient in person. I think there are certain cues that you can't necessarily get asynchronously, for sure, and synchronously as well. And so I think, yes, it can be a really positive thing, but I don't think it can totally replace the value that in-person healthcare brings.
Right. I don't know. That's a thorny one. I just finished reading a really, really good and powerful book that I'll just toss out and recommend to you and our audience, that definitely touches on lots of themes, including healthcare and the disparities in healthcare in the country. And it's by Barbara Kingsolver, and it's called Demon Copperhead. It's a play on David Copperfield, and is supposed to be sort of a modern day retelling of that story in both Tennessee and Virginia. And I mean, for anyone, I've never read a Barbara Kingsolver book before, and she's an excellent author. And really, the themes that she hits on in this book are very, very powerful. And I would recommend it if you're interested in more on how healthcare can look different depending on where you live. Let's talk about how doctor visits are evolving, since we're on that topic, and where one lives might definitely impact what sort of access one has to these kinds of services. But there are a lot of startups in the healthcare arena that are aiming to disrupt the way the whole one-on-one with your doctor situation works. Forward is one that I've read a lot about and that you've pointed out. Forward is a company that is a tech unicorn, which means it's received absolutely boatloads of financing and is opening offices throughout the country. And its focus is on a subscription model that is enhanced by insurance if you have it, but you don't have to have insurance. It winds up costing you about $150 a month. There are certain things that aren't included, like lab work, and of course, any sort of extensive healthcare that you might need, surgeries and things like that are not part of their plan. But what is part of their plan is the day-to-day health maintenance kind of things. And they've incorporated a whole lot of technology into their organization as far as knowing the most about you to be able to provide the best level of care. And they're not alone. There are other competitive services out there: One Medical, Carbon Health, Parsley Health, Eden Health, and Crossover Health are some other ones that I found. Tell us more about these kinds of services and your gut reaction to them.
Yeah, so I think overall it's really positive. I think just we've talked a lot about kind of telehealth and the accessibility of doctors and healthcare, and I think that these types of companies are really trying to change the way that patients interact with healthcare, and I think it's a really positive thing. I think specifically to the doctor visits, Forward is definitely one that I've looked at as an example, and they're definitely building a more kind of tech focused experience that feels very different than probably going to the doctor did, 30, 40 years ago, where, they're really using a lot more data, using things to help predict kind of, what you may experience later in life and kind of trying to intervene proactively versus reactively. And so I think that overall it's a really positive trend and makes healthcare feel a little bit less scary. And I think a good analogy that I had heard in the past is kind of like the experience of going to an Apple store. I think when they first kind of came out with that model was such a cool way to shop for technology that might have been very different than how we did it in the past. And I think obviously a very different space, but I think these healthcare companies are trying to make the feeling of going to the doctor a different experience that is maybe less scary and kind of burdensome than traditionally it has been, because ultimately people being on top of their visits, being on top of their healthcare is going to lead to better outcomes.
Do you have any personal experience with any of these kinds of services? Have you ever been to one, talked to their doctors?
Not directly, no. Most of what I'm basing on is kind of just interest in what I've read. I would say that I visited a couple of these kind of satellite type facilities during COVID a couple of different times trying to get COVID tests, and the experience as a patient to that degree was seamless. It was easy, efficient, and you know enjoyable. And so I think I can speak from that angle, but I know that the problems that these companies are addressing are much wider, and I don't have any direct experience with them from that lens.
Yeah, I'm really curious about them. Curious to see, what sort of caps they have to put eventually on the numbers of patients they take on, how many patients they're able to handle and serve efficiently and with a high caliber of care. But it looks like what they've done is look at, some of the other non-traditional doctor visit options that we have out there. You mentioned urgent care. We haven't talked about concierge medicine yet, but I'm sure that factored into their equation when they decided, okay, we're going to try and provide something that looks like that, but costs a lot less. And I think the subscription model is really interesting. $150 a month, and then it's less than that if you pay by the year. And I think that what might happen is people, who are employed and have an option to have healthcare through their employer might take that option to the most extreme the most catastrophic kind of care level and then pay out of pocket, or maybe they get underwritten by their employer and have some kind of stipend to pay for a service like this, because it's, incredibly reasonably priced, I think at $150 a month or thereabouts, for maybe not, reasonable depending on the quality of care and the degree of care that you get. And certainly untouchable for a lot of people in the United States at that price and without insurance. But I just think it's a very potentially disruptive kind of business model for the insurance industry. I wonder if you agree, and I wonder overall what you think about the future of health insurance. Do we need it? How will it evolve?
Yeah, I mean, in my opinion, I think health insurance is absolutely critical. And I think one of the big things we need to address the disparity in healthcare available is everyone needs to be covered by health insurance. And I think really, there's the happy path, which, health insurance may seem, obsolete to healthy people that don't have, big healthcare events or diagnoses that happen to them. But I think in the case that someone does get a bad diagnosis, and you think about, cancer or something of that nature, and you need to see specialists and you need to pay for these extremely high cost therapies, I think that's when you really need health insurance. And so I think from that perspective, I think health insurance is as critical as it has ever been. And I think, healthcare costs have been skyrocketing. I think it's, 18% ish of GDP now. And so, in my opinion, I worry about a world where people assume that they don't need to have health insurance. And then, some of these, more catastrophic diagnoses happen, what kind of situation it puts them in. But I do think that, it's amazing to have these types of options for people who maybe, see themselves as, healthy and want to, are willing to spend more on their healthcare to get a different type of experience. I think, these companies are offering a really cool solution for people. But I do think that health insurance is still critical. And I think getting everyone to be covered is really important in addressing some of that disparity we talked about earlier.
Yeah, I'm just wondering if, and again, these entities like Forward and the others we mentioned are very new and not very widespread yet. But as they begin to present a better option than urgent care, which can be quite pricey, or concierge care, which can be quite pricey as well, or alternatively, conventional doctor visits, which not only are pricey, but, in my own experience and anecdotally from those around me, are getting, the quality is declining rapidly. You're getting sort of a what was the baseball movie that was all about making baseball make money from the data?
Moneyball?
Yeah, that one. I feel like that kind of approach has been applied to medicine and winds up, overburdening doctors with volumes of patients that they just can't reasonably be expected to care for in any kind of quality way. And then you're, left kind of throwing up your hands saying, well, there are no good options. So maybe some of these new startup, subscription-based models will provide a good option for your maintenance healthcare, your checking in and checking up and staying healthy. And then people could have the option, or employers could have the option, they could elect through that and take care of scale and lowering costs that way, of subscribing to some catastrophic care kind of insurance that winds up lowering costs for everybody and increasing care for everybody. That's sort of the promise I see of these kinds of services, or what I think they could do.
Yeah.
Are you more pessimistic or?
No, I think, I like to look at things glass half full.
Mhm.
But I think, when from, just personal experience, those around me, you never know when these sorts of things can happen. And I think when you have, some sort of diagnosis for you or for a loved one, you want, them to get the highest quality that is available to them regardless of cost. And I think, unfortunately, if you're not insured, a lot of people have to make really tough decisions with kind of healthcare. And so I think health insurance, it it can seem obsolete when you don't use it except for your primary care coverage once a year that told you were totally healthy. But I think you just never know with these things. So I would say I'm a bit more cautious in my thinking around it.
Right. And our healthcare needs as a country aren't getting more manageable. I think they're getting more severe and uh, desperate. There are so many more people with so many more different kinds of conditions. We've got a huge mental health crisis in the country, physical health crisis. It's hard to separate the two. We have a huge drug addiction crisis in the country, and you throw the medical establishment and all of that at all of that, and it might not spit out satisfactory results. Do you have any good ideas from your position as someone on, the startup side of the healthcare industry and the forward-looking side on what sort of things we should be thinking about to better address the disparities in healthcare in the country and the more sort of desperate needs that seem to be piling on to the equation?
Yeah, so I think, from I touched on already, I think everyone needs to be covered by health insurance. I also think there's a Medicaid reimbursement problem that needs to be addressed. I've heard and read about that there are some doctors who don't accept Medicaid patients because the rates are so low, and they're losing money by taking on those patients. And so I think we need to have everyone covered, and we need to make sure that doctors can stay in business treating patients kind of across the spectrum in terms of different insurance types.
Mhm.
So I would say that's one. The second is, I think we definitely need to invest more in social care and public health in general. I think you talked about a couple of different crises that are out there. I think it's critical for us to invest in kind of social care and public health to um, get on top of those different issues. And then the last one, I think, is kind of addressing some of the disinformation problem that exists. I know we talked a little bit about it beforehand, but I think making sure that people are making decisions based on the guidance from healthcare professionals that are treating them, I think, is really important versus making decisions based on information that may or may not be based in fact and science.
Right. What are your thoughts on that? I mean, that is such a huge problem to try and tackle. I know I'm guilty of this. I'm sure lots of people are, that when there's something a little bit amiss or awry and you're wondering about it and you're scratching your head, before you even call your doctor, you jump online and try and figure out what's going on. And who knows what sort of information you're getting from that source before you talk to your doctor. I mean, in my own case, it's been pretty good. Like, I've gotten some good ideas and I can go in and have an intelligent conversation with my doctor. But I could definitely see it going the other way.
Yeah,
How do we control for that?
so it's a really good question because I think people having access to information is really important, but I also think it's probably good to note that when you Google something, the first result may not be. Yeah, I think healthcare is complex. Every person is unique, and so what I've found in my case, it often presents the doomsday scenario that isn't always accurate. I'll give a quick a quick kind of story of mine where I, I was experiencing some dizziness, and I kind of looked up online, I'm experiencing dizziness, what's going on? And the first kind of thing that popped up was heart attack. And, I was suddenly very worried. Is there something going on? And it turns out, I was just bad night's sleep, a little bit dehydrated, and felt a little bit off that day. But I think that it shows you that, I think it's really good to have a lot of information available to people, but I think it's really important that you don't come to conclusions on your own, and that you use that information to have an informed conversation with a healthcare professional, exactly as you said, versus coming to a conclusion yourself that this is what's wrong with me and this is what I have to do, because that information that you may be basing that decision on may not be accurate. It may just be one side of the story. It may be for just a certain subset of individuals. And so I think it's amazing to have access to information, but important to um, draw conclusions with a healthcare professional versus on your own.
Yeah, the internet is no friend to hypochondriacs, that's for sure.
Exactly.
Um, do you think that social media companies bear a responsibility here, or are they just part of the free for all of the web?
It's hard to say. I think, you know, to a degree, I think they're a part of the free for all of the web. I think the disinformation problem is a really, really hard one to get in front of, and I think it's really, really top of mind given everything that has gone on in the world in the last couple of years. Vaccines, I think, is the perfect example, and yeah, I don't think the problem, starts and ends with social media companies necessarily. I think it's a bit more widespread than that, and I think it's a really tricky problem to tackle.
Yeah, definitely. I could see, I mean, my own thought is that children need to start learning in very early grades about the reliability of the information that they get on any number of topics, including healthcare, and how to verify and know what to trust. And that, for those of us who aren't going to get it in elementary school, I don't know how we get that point across, but um, it would be helpful. Do you agree?
Yeah, no, absolutely. I think kind of putting that into the curriculum, just in terms of the things that I think we need to be educated on are changing in the world, and so I think kind of ensuring that people can evaluate the reliability of sources and go to what might be credible sources for information, and then use that information in the right way is totally critical. But I think it's a really challenging problem to solve, without a doubt.
Yeah. You mentioned earlier how having a robust technology infrastructure in our healthcare system might increase costs. But what technologies are out there? What ideas are out there that might help reduce costs across the board?
Yeah, so I mean, I think AI, we touched on a bit, right? If AI can help remove some of the expensive administrative costs, I think that that will help take some of the cost out of the system. So I would say that's one. A second one, I think, that we haven't touched as much on, but it really around like preventative healthcare. I think if through screening, through kind of more data, you can predict a healthcare outcome before it happens and prevent it. If you can prevent an ER visit, the amount of cost that that saves the system is pretty incredible. So I think preventative healthcare can be really powerful in addressing rising costs. And then I would say the last one is the government stepping in on some of the high cost drugs. I think insulin is a really good example where you know the life science companies have come out and lowered the price of insulin, which people need to survive. And I think where we can control the cost of drugs like insulin, I think will have a really meaningful impact on total spend.
So along the lines of technologies that may or may not reduce cost, but hopefully will enhance our overall healthcare profile. People know about watches. We talked about things like having a blood pressure monitor at home. What other kinds of devices can we expect to see integrated into our lives to help keep us healthy?
Yeah, I mean, I think what's really exciting is kind of the idea of merging these all in one to a degree. I mean, I think, I have an Apple Watch that measures my activity and heart rate today. I'm sure it can do more than that, sleep and whatnot. But think about a world where you have something that could track your glucose, your blood pressure, your heart rate, all of these things all in one, and then feed all of that data to the healthcare professional. I think it's a really cool and powerful tool for people to have. And so I think that's one. The second is, this just the increase in kind of diagnostic testing. I think is important in terms of understanding, getting labs to understand, you know, what what your various levels look like to give kind of a baseline, and then taking steps to try and improve things like cholesterol or those sorts of things. I think kind of diagnostic testing increases for patients is really critical. And then the last one I would just say is advancements in being able to synthesize and use the breadth of data that's available in the healthcare world. Will be extremely helpful. So I threw a couple of out there, but yeah, I think those are all very exciting pieces.
Yeah, I do too. And of course, I'm sure you followed along with the saga of Theranos and Elizabeth Holmes. And on the diagnostic testing front, that didn't wind up being something that turned out to be as revolutionary or revolutionary at all as it was promoted to be. But the idea that we need to, first of all, make more uniform the kinds of testing that people have access to and that it is prescribed for people. I mean, in my own experience, just based on different doctors that I've seen, there's a huge amount of variety and variation in what one doctor will have you undergo as
Yeah.
opposed to the next. And then, of course, there's the whole blood draw thing, which Theranos was out to disrupt. But even if we do have to sit there and have vials and vials of blood taken out of us, which is what's involved in doing a really extensive panel of blood work like you're talking about, do you see any sort of developments on the horizon that can bring some uniformity and make it more acceptable or the norm that we need more of this kind of testing in order to monitor people's health?
Well, I think, some of the companies that we talked about earlier, like a Forward or a One Medical, I think a lot of those companies are implementing those types of practices. And I think hopefully that will sort of, that will elevate experiences kind of across the healthcare system. I think hopefully, these types of companies that come in to disrupt the way that healthcare is being delivered will hopefully elevate the whole system to adopt these types of practices. And so I think that the hope is that, as these types of innovative companies that are doing healthcare differently but more effectively come into play, that other larger institutions will adopt similar practices, and it will become more of the norm versus the disruptor. And ultimately we'll see the benefit of that to the healthcare system as a whole.
Right. Do you think that the role of the patient is getting bigger, the role of one's own autonomy in one's healthcare? Of course, if we're getting crappy information off the internet, take it with a grain of salt. But it seems to me like shared decision making and patient empowerment, I think, are things I hear a lot about in the medical field as priorities. What do you think of those concepts, and how does that look going forward?
Yeah, I mean, I think again, it's somewhat nuanced in how you look at it, but I think on the positive side, I mean, having far more information available to patients is really powerful if you use it in the right way, in terms of having that informed conversation with your doctor. Hey, I read about this. What are your thoughts? Kind of, I was also reading about this. Kind of, what are the pros and cons of sort of the treatment I'm considering, those sorts of things. I think having that information allows you to really have an informed conversation with your doctor. And I think that can be really powerful and help you make the best decision in kind of partnership with your doctor versus having the doctor just recommend what he or she thinks is beneficial to, 99% of the public. But again, I mean, I think we've talked about it a lot already on the negative side of, there is disinformation out there. Self diagnoses can be dangerous in terms of rushing to conclusions in terms of what you think you may or may not have. And so again, I think patient empowerment can be a really positive thing, but I think it needs to be sort of in the right conversation and using information in the right way to really reap that benefit.
So, Peter, we've talked a lot about a whole range of things. You've paid attention to these issues for a long time, and I'm wondering what you might think is coming at us that most of us don't know about yet or expect.
Yeah, I think one of the things we talked about a little bit is, will kind of cybercrime kind of come into play in healthcare and kind of, companies be trying to access confidential healthcare records or, people trying to falsify healthcare information. I think that's something that's interesting to think about in the future and kind of plan around. The other thing that I would say is I think there's going to be a lot of difficult choices around very expensive drugs. I mean, the space that has been really interesting to me is, the weight loss therapies and GLP-1s, that kind of trend. And, when you think about the potential cost, I think, those therapies can cost around $1,000 per month. And if you think about, multiplying that by 12 months, multiplied by 40% of the US population suffers from obesity, you can think about how crazy those numbers could get. And so I think there's going to be some difficult choices around these very expensive drugs, around who can access them, those sorts of things. And so I think that's coming quite quickly as we think about trying to get healthcare spend under control, but also offer the most efficacious therapies to the public.
Right. And I haven't talked about this with my licensed and competent medical professional, but instead, I'm just getting word of mouth from friends and the internet on those weight loss oriented drugs. But anecdotally, what I've heard is that when you go off them, the weight comes back. So you have to stay on. And so you're looking at a considerable expense if that's going to be your lifetime obesity management tool.
Exactly. Yep. Couldn't agree more.
Yeah. All right. So, what is on the horizon that most excites you in the healthcare arena?
I think the whole how AI will kind of make healthcare more efficient is incredibly exciting. I think the wearables being able to do to just access more information about your health and using that to kind of inform decisions with a healthcare professional is really exciting. And I think the continued development in drugs. I think some of the data that we're seeing in spaces like oncology where diagnoses used to be really dire and still are, but I think the outlook is a lot more hopeful, and I'm excited for continued development in that space in the future.
Yeah. I am curious about you keep bringing up the really difficult part of our healthcare system, and that is that for very serious life-threatening diseases, the treatments can be very, very expensive and hard to get, and of course, they're difficult to go through as a patient, but it becomes even more difficult to go through as a patient and a patient's family when you're wondering all the time about how you're paying for these life-saving treatments. Do you think that our insurance system, as it exists today, handles that situation well, or could it or should it be adjusted?
It's difficult. I think you know I think there are lots of people that get access to these drugs that wouldn't be able to afford them out of pocket. And so from that angle, I think, the system is working to a degree, but I'm not going to say that I think it can't be improved. I know that sometimes, there can be a lot of challenges in getting these like more expensive drugs covered through insurance and things like prior authorizations, those sorts of things. And so I think there's definitely room for improvement, but I think ultimately, you know, the fact that people are able to get access to these drugs, get these drugs that they otherwise could not afford, shows the value that health insurance brings to people, even in kind of the current state today. But I think, like everything, there's definitely room for improvement.
Do you have a position? Have you made up your mind one way or the other on whether it would be better to have more nationalized healthcare or whether it's better to have the laissez-faire economy bring competition to the field and hopefully bring down costs and provide variety of options?
Yeah, I think there's, pros and cons to both. In my opinion, kind of where I stand on just sort of health insurance in general is that I think there needs to be an option out there for everyone, whether that falls on the spectrum of nationalized healthcare or in kind of the model where there are different companies competing. I think everyone needs to be covered, and I think that's critical in addressing some of the disparity that we see in the US and the difference in kind of the way that healthcare is distributed versus what you see in other countries. And so I think you can approach it in different ways, but I think ultimately what's critical, and I think kind of the metric that we should be anchored to is, does every person in the country have access to health insurance and the ability to access healthcare when they need to.
Right. Of course, the answer to that is no. So it's it's something that I think as a country we need to address and really encourage the medical profession to also address from an ethical standpoint. On the topic of bioethics, are there any hot topics that have grabbed your attention beyond that one?
No, I think, I mean, that's the big one that I've
Mhm.
I've really been interested in. Are there kind of other ones that you've been monitoring closely?
Oh, I guess, it runs the gamut of you've brought up, how we handle people's information and how we make sure that it is secure and used in ways that they consent to, and in ways that they consent to in a valid way, in ways that benefit their well-being and not some third party that's profiting off the data. So I definitely think there's a whole universe of bioethical concerns around data. Um, and also around treatments as well, who has access to what, um, whether costs should be a factor or not in making decisions. Recently, I've been reading about potential issues. And again, this is not something that I am any kind of expert on, and my understanding is that to the extent there are any concerns, they are minor and the whole system is safe. But I have been reading about concerns with generic drugs and quality control. And I'm wondering if you have too, and if you have any thoughts on that.
Yeah, I haven't heard as much there, although I'm sure it's definitely a topic of conversation. I mean, I think there's, you know, generics are really important in terms of driving drug costs down. So I think that the value that they bring to the system is, it's apparent and it's, monumental. But I think obviously, to your point, we need to make sure that we're not sacrificing quality in that process. And so, I don't, I'm not aware of kind of any sort of issues there, but I could definitely see that that could become a concern in the future. And it's critical that, you know, the regulations that we have in place ensures that the quality of the drugs that we are getting, whether they be generic or brand, are, parallel and equal in terms of the efficacy that they bring to patients.
Right. All right. So, in your entire young lifetime, what is the single most important change to healthcare, and medicine that you've witnessed?
Yeah, I mean, I think it's the advancement of therapies. I have someone close to me that unfortunately was diagnosed with cancer, and the outlook 20 years ago was kind of a watch and wait approach of basically you progress until unfortunately the disease takes you, and now the outlook is that you can extend progression free survival by 20 plus years before you even have to think about a next treatment. And having someone close to me go through that, I am just so thankful that that happened now versus happening 20 years ago. And I think I'm really excited about the idea that what could that look like 20 years from now. And so I think for me, the technology behind these new therapies that are coming, and the kind of them using kind of your body to be able to fight off these diseases is just so cool. And I'm excited to see where it goes from there.
Yeah, I'm excited too. And that's a really high note to end on. Thank you so much, Peter Joyner, for joining us today. Peter is a senior manager in charge of customer strategy and growth at startup TruePill. So we'll keep an eye on you and your company. And we really, really appreciate all of your insights and wisdom today that you've shared with us.
Yeah, thank you so much for having me on, Denise, and really appreciate it. And I'm sure we'll be in touch soon.
I'm sure we will. Thank you, Peter. Take care. And thanks to all of you for tuning in to Uneven Distribution here on the Hearsay Culture Network. We do this show I'm sorry, I'm saying that wrong. Twice monthly. Bi-monthly would be every other month, I believe. So we do it twice monthly, along with a host of other shows here on the network, which I encourage you to check out if you have not already. And I also encourage you to check out our subscription options so that you can gain even further insights from the guests that we have on our shows. You can gain access to video content and a whole bunch of other nice perks that we hope we're able to offer you in exchange for your further support of our network and our offerings here. Thanks so much, Peter. We'll see you next time on Uneven Distribution.
Thanks so much.
All right. So that's the main show. Thank you. That was wonderful. Appreciated
Awesome.
all your thoughts.
Yeah, of course.
And then what we'll do is I just have like a couple more questions that I didn't get to. So we'll do those now as sort of the after show segment. One of the ones was the one, what it looks like from a healthcare perspective to be older, say 20 years from now, what sort of changes we can expect to see. And I also wanted to ask what it might look like to be younger, like what sort of different approaches to healthcare for children and what sort of education we might give them to give them a better run at good health throughout their life. So let's do those two. And then the other one is, let's start with this one. Your biggest concerns about the future of healthcare. So let's start with that one, and then we'll go to what it will look like to be old and what it will look like to be young, and then we'll wrap up.
Sounds good.
Okay.
So I think in terms of...
Oh, wait. So I'm going to intro us, and then we'll roll into that.
Perfect. That sounds good.
Yeah. Hi, folks. I'm Denise Howell, and we're here after my interview with Peter Joyner, Senior Manager in charge of customer strategy and growth at TruePill, a startup in the consumer healthcare arena funded by Y Combinator and others. TruePill connects telehealth and pharmacy infrastructure. And we've just wrapped a great interview where I learned so much from Peter. Peter, thank you so much for joining us for our post-interview segment here.
Of course. Thanks for keeping me on a little bit longer.
Of course. Of course, I'm always full of questions, and I hope our audience is ready to hear more from you too. One thing I'm interested in that we didn't cover in the body of our interview is looking ahead what your biggest concerns might be about healthcare, and medicine in the United States.
Yeah, so I mean, I think we touched on some of these throughout, but I think if I were to summarize some of the big ones that I think I would say I'm most concerned with. The first one would be just kind of the difficult choices around very expensive drugs. We talked about the weight loss example. We also talked about an example of, immunotherapies for oncology patients that might cost, $500,000 per patient. And so, I think where healthcare already represents 18% of our GDP, and when you think about the new technology and new drugs that are coming to the forefront, how do we make sure that costs are controlled and don't rise even more? Because I think that's a critical problem that faces our system today. So I think that's one big one. The second big one I would say is just around sort of the double-edged sword that I think having all of this data available to us brings. I think it can be really positive in all of the things that we talked about, with people having access to different information, and companies, healthcare providers having access to this information. But I think it can be scary to think about what that data could potentially be used for in a pessimistic way. So I think about if someone is applying for a job, could in theory an employer look at that person's medical profile, see that they have a history of maybe mental illness as an example, and use that to make a hiring decision. And so I think that the availability of data and what it could potentially be used against can be looked at glass half empty. So I would say that I think those are really the two big ones that I would say are somewhat concerning to me. And I think the other one that came up in our conversation that you brought up that's really interesting is, and maybe connects to number two a bit, but is the aspect of privacy and cybercrime, and could this data get into the hands of those that we don't want it to. So I would say those are kind of the three ones. I think two and three are pretty linked closely there.
Yeah, that 18% GDP number is walloping. I did not realize that was what our healthcare spending amounted to.
Yeah, I hope that number's right, because I saw it recently. So hopefully I'm looking at good sources as
Yeah.
we talked about. But yes, it's crazy.
Yeah, that's an incredible chunk of change. And also, as you're talking about, possible misuses of data, my brain is going straight to all the Black Mirror episodes I have not yet watched, and also sci-fi classics like Gattaca, where Ethan Hawke's character had a live-in friend providing the genetic information that he needed to be able to carry on the job that he most dreamed of pursuing. How realistic do you think something like that might be?
It's hard to say. I think it's achievable, to a degree. I think there are a lot of things that we need to, a lot of steps that we need to put into place to get there ultimately.
Mhm.
But I mean, I think ultimately, I have an outlook that I would say, it may sound pessimistic here, but I think overall the direction that healthcare is going, and the intersection of technology and healthcare is really, really exciting. And so I think from a vision perspective, I think healthcare could look very different and a lot better 20, 30, 40 years from now. So I think that vision is achievable.
And it sounds like it's going to be up to our regulators to put measures in place that would put controls on employers as to what sort of information they might be able to purchase and consider about future employees. Do you agree?
Absolutely. I think
Yeah.
that's exactly right. And we also talked about, the wearables, right? So if you have an Apple Watch, your data is going to Apple as well, right? And so I think it's not only sort of healthcare providers. I think there are companies that aren't, naturally healthcare companies that are now getting access to a lot of healthcare data. And so I think it's, that's a positive thing, but it adds complexity in terms of the privacy problem and the security of data and whatnot.
Yeah. So we're getting to the point where we have more and more people living longer and healthier lives, and that's a good thing overall. It puts some challenges on the system that we might not have had 50 or 100 years ago. I'm curious what you think on balance being 85 years old will look like in the United States from a healthcare perspective 20 years from now, as opposed to what it looks like today.
Yeah, so it's interesting. I don't think being 85 20 years from now will look that much different than it does today. I think overall, mortality rates are not improving in the US at the rate that you'd like to see to think that, 20 years from now, being 85 would be that much different. But I think, when we think about the younger kind of generations, I do think it will look quite different. Um, I can give kind of one example of myself personally versus kind of friends my age, and I think this trend will continue. But as a part of kind of my primary care visit this year, I did sort of an abundance of different labs just to get a baseline of, hey, what is my cholesterol, what is this, what is that, these different levels that then we can use to measure next year. I can have the same thing done to say, hey, I know you were working on kind of your diet as an example, eating healthier to get your cholesterol numbers down. Did that happen? Did it not? Why might that be? Why might not it be? And, I don't think that is normal when I look at kind of my friends, of kind of a similar age. I don't think all of them consistently have made their, primary care visits or have used, labs and diagnostics to help better understand their healthcare. And so I think overall that will become more normal with time. And I think that will bring a lot of benefits. I just don't, I think it will impact the younger generation kind of more quickly than it will impact the older generation when we think 20 years from now.
Yeah, that doesn't surprise me at all that younger folks are a little bit more cavalier about their health care. It's not really a big concern. They feel good, they're young, they're healthy, and they're not really, interested in spending that much time in their doctor's office. They'd rather be off living their lives and working their jobs. But I guess my next question was going to be about whether you thought being a young person, a very young person in the healthcare system would look different, say 20 years from now, whether the emphases that we give to children as they're interacting with their doctors might change those attitudes.
I'm sure that it will. I think there will be a lot more technology incorporated into doctor visits, right? I think there's those full body scans that you can do to get, height, weight, all sorts of different metrics. And I'm sure that, as a part of, the primary care visits at a pediatrician's office, 20 years from now, it will look different and it will incorporate that technology. And then I think the way that healthcare is delivered might change a bit as well in terms of more diagnostics, more data collected to hopefully kind of better understand what might happen down the road, and to implement measures to prevent that, when applicable.
Right. I mean, that's kind of what our whole vaccine infrastructure aims at doing, is preventing terrible things from happening down the road. And one could see that, certainly most children, I would hope, in the United States are part of that process already. So hopefully, the kinds of things we've been talking about today would percolate over into the other areas of their long-term healthcare as well.
Yeah, yeah, absolutely.
Yeah. All right, Peter, it's been such a joy to sit down with you today and ponder the future of healthcare. We really appreciate your insights and thoughts and vision. And just thank you so much for taking the time.
Of course, yeah. Thank you so much for having me, and yeah, looking forward to staying in touch.
Me too. All right, take care.
Bye.
Okay, so we will end the recording at this point.